My Doctor, your health anytime, anywhere. Hello, lovely people. Welcome to the My Doctor podcast. My name is Mwesigwa Joy, and I am your host. So on this podcast, we basically get complex health issues and simplify them for you. We want you to be equipped with knowledge about your health. How do you prevent certain illnesses? How can you prevent certain things in your life? Or if you get an illness, how can you treat it? Basically, everything to do with health. So today we have a topic that affects millions of lives, but is still associated with myths, with confusion, with stigma, and that is contraception. Today we're going to be discussing contraception. What are the various methods that you could use? What is contraception to start with? And today I'm here with an expert that is going to be talking to us. You're welcome, Dr. David.
Thank you very much.
Thank you so much for coming to this show. Could you please introduce yourself to our viewers and tell them who you are? Yeah.
Thank you very much for hosting me today. I'm by the names of Dr. David Mwesigwa, and I'm the medical in charge of My Doctor, Digital Healthcare Services. I'm so privileged to be here today to discuss health. As Joy has introduced to you, today we shall be discussing contraception. So someone will ask themselves, what is contraception? To me, in my simple understanding, I would define contraception as any act someone partakes to prevent pregnancy. So it could be either a behavior, it could be medical intervention, those are drugs, or sometimes it could be devices. But it is always an act that someone partakes to prevent pregnancy or conceiving. Yes, please.
Okay. So what are some of the methods? Maybe we could start with natural. Some of the methods that someone can use that don't involve like going to hospital or taking pills or devices.
So contraception is a little bit broad. As I told you, it involves devices, it involves drugs, and sometimes it involves just behavior. Okay. So we try to categorize them into two broad categories. Those are the natural ways, and then we also have what we call the artificial ways of preventing pregnancy. So we start with the natural ways because that is something natural and that is already something to begin with. The natural ways is whereby someone uses her body or the partner's body to ensure that they prevent getting pregnant. These are natural ways. Some of these ways are either planned, others are even when someone is not even aware. So which ways are those? We have what we call the fertility awareness methods. Now this one usually is based on the woman's side. I understand my body. I understand or predict when I'm going to be fertile, and then I avoid either sexual intercourse or I do measures in such periods to ensure that I do not conceive. One of their fertility awareness method is the cervical mucus monitoring. This is whereby a woman monitors the mucus from her cervix on a daily to ensure that in those periods or moments whereby she expects to be fertile, she avoids sexual intercourse. It's a little bit tricky because it calls upon, first of all, for you to understand yourself and then to also understand how your body produces mucus and how it changes in the different periods of your menstrual cycle. But maybe just to give a simple hint, in days whereby a woman is fertile, the mucus is always very thin. Yes, very, very thin. And in the days when the woman is not fertile, the mucus is always thick or thicker than usual. Yes, please. So if someone gives that too much attention and gets to learn how to use the cervical mucus, you always see that towards your ovulation, the mucus will become thinner. And this will allow penetration of the sperms if at all you have sexual intercourse in those days. Another method. Yes, please.
Are there other ways a woman can know they are fertile? apart from the mucus? Like, is there any other thing they can feel in their body to know that maybe I'm fertile at this point in time?
Yes, please. Another method is what we call the basal temperature monitoring. This is whereby a woman measures her temperature at rest, especially in the morning when you're just waking up, and then we monitor it. However, all these natural family planning methods are not 100% effective, but they can always help us, and we tell when maybe someone is going into the fertile days or even after the ovulation. So in those days whereby when we are using the basal temperature monitoring, in the days when someone is ovulating, usually the basal body temperature try to rise slightly compared to other days. But I say we can't rely on these methods 100% because our body temperature can be influenced by a number of factors like sickness, like stress. Sometimes it could be the geographic conditions. If you are in Uganda, your body temperature can be affected by the too much heat. And if you are maybe in other countries whereby they experience winter, of course the body temperature can also be affected by the geographical and weather conditions. Another natural method that we can talk about is what we call abstinence. Abstinence is a natural method which can either be forced or sometimes planned. What do I mean by forced? Forced abstinence, this usually happens on the young children. Someone doesn't want to conceive, and because of those values and beliefs, they are forced to abstain such that they don't conceive. Planned abstinence, or what we call periodic abstinence. Now this happens maybe when someone is in a relationship with the spouse and they intend not to conceive, so they will plan to abstain from sexual intercourse on those specific days when someone is fertile or is in the ovulation phase. Another method that is natural that we can use is all about knowing your menstrual cycle, and then we calculate what people usually call the safe days. The method of calculating the safe days, of course, it varies from person to person because our menstrual cycles are different. Our bodies are different and our menstrual cycles are different. But for ladies who have what we call the regular menstrual periods, it is very easy for them to calculate the safe days, of course, with the help of your healthcare practitioner nowadays with apps and so on. It can help you track when you're safe and when you're not safe. Yes, please.
Is there a way like I can count? I'm like, I've started today. Is there a way I can start to learn how to count my cycle? Because most people don't know their cycles.
Yes, we can teach you. For the sake of the viewers here, I'll give a brief hint. However, as I stated earlier, this varies from person to person. So sometimes it might need you to first try to track your periods, visit your healthcare practitioner, and then they teach you to calculate your periods basing on how you've been tracking them. Because when you meet me 1 day or 2 days of consultation, I may not be able to track your periods, how they have been. However, in a regular menstrual cycle, it usually takes an average of 28 days. That is from the day when a lady or a woman sees her very first menstrual blood up to the day of the next cycle. Usually, on average, women take between 3 to 5 days. That is usually, and it is normal. So we calculate the first day as day 1. We take those days of menstruating, day 2, day 3, day 4, day 5, depending on how you usually respond. So from day 1, we calculate and we expect you to ovulate on the 14th day. That is if your cycle is for 28 days. So we expect you to ovulate on day 14. So you start counting from the very first day. Day 1, day 2, day 3, day 4. Of course, those days we don't advise people to have sexual intercourse because you'll be menstruating. So after your menstruation, depending on the days you've taken, usually it can be around day 5, day 6, day 7, day 8, and day 9. We are always safe. Hope I'm clear. From the time you start seeing your periods, the first days you can't have sexual intercourse, but then that day 4, day 5, day 6, day 7, day 8, and day 9, we are always very safe. When if you have sexual intercourse during that time, you cannot conceive. Then from day 10, day 11, day 12, day 13, day 14, day 15, day 16, and day 17, a woman is always not safe. Why? Whenever a man releases their sperms, they have the ability to stay in the body. Of course, the books are always not so sure, but they always say between 3 to 5 days. So, if I have sexual intercourse on day 10, there is a possibility that the sperm can remain viable in the uterus from day 10 up to day 14 when I have my ovulation. That's why we say that from day 10, a lady is not safe. Of course, you will not conceive on day 10, but you will conceive on the other 14th day when the egg has been released, or what we call ovulation. Then also after ovulation, we expect the egg to remain viable for about 72 hours. That's why we say that even after the 14th day, day 15, day 16, and 17, you can conceive because the egg is still viable. Now from day 18 up to day 28, you're very safe, unless otherwise.
Is there a possibility of another egg being released somewhere?
That's why I said unless otherwise. There are in some extreme cases whereby someone has medical conditions that lead to abnormalities. You find yourself, someone maybe releases an egg when this menstrual cycle is still on. Although those are extreme and very rare cases. Okay. Yes, please.
I'm requesting to take you back a little. When we're talking about the menstruation, you mentioned how it's not advisable for people to have intercourse when the lady is menstruating. Could you tell us why it's not advisable and what could happen?
It's not advisable medically. Of course, with our different beliefs and cultures, there are people who do so, and in medical practice, we always meet such people. And they also attach some other advantages of having sexual intercourse in those periods, but medically, we don't advise it. Why? Whenever a lady is menstruating, we expect the cervix to be a little bit open. So there are very many higher chances of having infections flow from the vaginal wall to the uterus because the cervix is somewhat open. Then secondly, because of the action of penetration, the back and forth, there could be a pushback of the menstrual blood back to the uterus because remember I told you the cervix is slightly open. The backflow or the pushback of that menstrual blood, of course, it can come with a number of complications because this menstrual blood has already been declared unwanted by the body and is supposed to come out. So once we have that back and forth and it is retained, it can come with a number of challenges and health concerns.
Okay. So still in regards to the natural methods, I would like us to talk about withdrawal. What is withdrawal method? Does it work? Is it safe? Yeah.
So I had not yet finished the natural methods. So one of the methods, as you've talked, is called withdrawal methods. In medical, we call it coitus interruptus. This is whereby in the act of having sexual intercourse, at that moment when the man is about to ejaculate, he withdraws the penis from the vagina and then ejaculates from outside the body. Coitus interruptus is always supposed to be a mutual consent between the two partners. But it's a very, very, very tricky method. And through practice, we've seen very many ladies who have conceived while using that method, because at that moment of ejaculation, to some people from experience already say that is the biggest time whereby they feel the highest sexual pleasure. So it calls about a commitment from the spouse or the husband to stop the penetration at that moment whereby he was supposed to enjoy the more. Then secondly, whenever we are having sexual intercourse, there is what we call the pre-ejaculatory fluid that is released. Sometimes that fluid can contain sperms. So someone might perfectly do the withdrawal. However, when the pre-ejaculatory fluid has been already released and the sperms are there. Then also, we always caution people that when you're doing withdrawal, after you ejaculating for the first time, or maybe after the first round, a man is advised to go and pass urine or urinate, and then also wash his private area to ensure that he clears any residual sperms that could have remained either in the urethra or on top of the glans penis. So that's why I say it calls a lot of commitment, understanding your body, and then also understanding how the method works to be fully effective. Yeah, but most people, there is a time whereby someone fails to withdraw at that very time of ejaculation and ends up releasing. Yes, please.
Then there's still about withdrawal. There's also a saying that when the gentleman is withdrawing and maybe they withdraw around the vaginal opening, that the sperms could swim in. Is that a myth, or are they supposed to withdraw to another part that's known the lady, or if they withdraw around the vaginal opening, can the sperm find a way of entering?
If someone withdraws from around the vaginal opening, there is a possibility that the sperms can swim in. However, the possibility, of course, the percentage keeps on reducing if at all it is outside or when it is inside. Yes, please.
Okay. Then still, are there any other natural
another natural method that is really, actually it is the most effective natural family planning method, is what we call lactation amenorrhea or breastfeeding. If a woman gives birth and they exclusively breastfeed their children, they breastfeed them daily, the number of times that is recommended, that is around 8 to 12. It always helps prevent ovulation, and the woman will be safe until maybe they start weaning off the children and they start experiencing their menstrual periods. Yes, please.
Okay, and then this may be off topic, but then with the mothers, if a mother has given birth, after how long are they advised to resume sexual intercourse? Like, if I've given birth today, after how many weeks can I resume?
That question carries a lot of controversies because it moves from medical belief, or for us what we understand medically, to cultural belief. However, to us medically, if a woman has given birth normally, or what we call vaginally, we advise them to take at least 6 weeks. That is 1.5 months. It will be appropriate for someone to have coitus. For someone who has had a cesarean section, of course, we would say that after the 6 weeks, we expect her to be okay. However, it always varies from woman to woman and how your wife or madam is feeling at that moment.
Okay. So as we come to the end of the natural methods, are there any methods that we could have missed out?
Of course, off head, those are the methods that I thought about, and those are the most widely used methods and known methods for natural family planning.
Okay, so these natural methods, are they as effective as the artificial ones? And who may be more suitable for them? Like, which ladies could be more suitable for those methods?
Natural methods can never be more effective than the artificial methods, because you see, as I tried to explain and elaborate them, most of them we are always just suspecting. I suspect maybe now I'm fertile. You're not 100% sure. So that means you suspect that maybe right now I'm not fertile, and then something happens. However, the most effective one, as I told you, is the lactational amenorrhea, because the moment you're breastfeeding exclusively, you will not see your periods, and we are 100% sure you will not conceive. Not until you start maybe weaning the baby, and then you start seeing your periods. All women can qualify to use the natural methods. However, methods that include the cervical mucus monitoring, basal body temperature, they need a serious and deep understanding of your body. Sometimes you have to do some research, you read, and then also take time to understand how your body responds, which varies in the different periods of your cycle. But all women of all age categories could qualify to use for all those methods, provided someone, of course, has become sexually active. Yeah.
As we have come to the end of the episode about the natural methods, could you please give the audience a take-home message or the last remarks about natural methods?
My remarks about the natural family planning methods is that, first of all, it is what would be the first priority for every woman, because when you try to look at the pros and cons compared to the artificial methods, of course, there are lesser side effects and disadvantages health-wise. Natural health methods, of course, they are you get them at a low cost. It's just a matter of understanding your body, and you start implementing them. You can access them at any time because you're just understanding yourself, compared to the artificial, whereby you have to seek attention of a healthcare provider, yes, and so on. However, the take-home message is they are less effective compared to the artificial methods, and you have to first fully understand them.
Okay, thank you so much, Dr. David, for teaching us about the natural methods. To our audience, hope you have learned about your menstrual cycle, to the ladies, the lactation, amenorrhea methods, withdrawal method, how to do all these natural methods correctly. So for today, we're going to stop here, but in the next episode, we'll still have Dr. David talking about the artificial methods. Yeah, we want you to have a full picture of the contraception so that you choose wisely what you want to use and what is best for you and your spouse. Thank you so much for watching this episode. My name is Mwesigwa Joy. I am your host. This is the My Doctor podcast. My Doctor, your health anytime, anywhere.
My Doctor, your health anytime, anywhere.